Well, it seems like every week we are learning something new about the coronavirus and how it behaves. And as always, to sort through all of these developments, we're joined once again by our medical expert, Dr. Arnold Baskies, joining us live. He is the past chairman of the National Board of Directors of the American Cancer Society and chair of the Global Cancer Control Advisory Council. Welcome once again, Doc. How are you?
Good morning, Lucy.
So let's talk a little bit more about testing. This week, the governor of Ohio tested positive for coronavirus, but later in the same day, Doc, he tests negative. And that really underscores the questions about the accuracy of these tests. Which are better? Which one is more accurate?
So there is really a fair amount of confusion surrounding this whole issue. So let me try to simplify this. There are two types of coronavirus tests in the United States. The most common test for coronavirus looks for viral DNA in a sample taken with a swab in a person's nose or throat. Test results can come back in 15 to 45 minutes for some of the newer tests, like the one that Mr. DeWine had, or there is a more accurate PCR test that forces you to wait 3 to 4 days for the result to come back. So Mr. DeWine had two tests, one which was the quick test, the other was the PCR test, which is slower. In order to ramp up testing to a level that we need to stop the spread of the virus, we're working towards a strategy that casts kind of a wide net with widespread adoption of faster but less accurate tests. Does that mean that you shouldn't get a test? No. What it means is that the fast test is less accurate, but it will pick up people with large amounts of virus. So even though it's less accurate at finding small amounts of virus, the quick test can be very helpful, because if you have a large amount of virus, those are the people that will be spreading the disease. So in terms of spreading the disease, it's a good idea to get the fast test, because then we know whether or not you have the capability of spreading the virus in a way that could be damaging to the population as a whole. The PCR test, however, is more accurate, but it takes longer.
Right, exactly. You get what you wait for at that point. The CDC also released two new reports that show how children can get severely ill from COVID. The report involves MIS-C. That's the acronym for this disease. It's something that we haven't talked about for a while. Bring us up to date on what more they know about MIS-C.
So with MIS-C, which stands for multi-system inflammatory syndrome in children, there's a long list of symptoms that can be associated with this. Fever, rash, GI problems, shock, and inflammation. Those are the parts of the MIS-C, or multi-system inflammatory syndrome in children, that we look for. This is a very rare event, however. Your viewers should be aware that this is not common. It's very, very unusual for a child to develop this. In all of the cases that have been reported, there's been about 570 kids who have had this total. That's not a lot of kids. In fact, the rate of getting COVID in children is very, very low. And the hospitalization rate is very, very low. So if you look at all the kids who get COVID, only 8 in 100,000 end up in the hospital, whereas in adults, 165 people per 100,000 can end up in the hospital. So this is not common, but it is something to be concerned about. This will present later after the child has had COVID. So we have to be on the lookout for it. We have to be concerned about it. But it's very rare, and it's not something that we should be going to shock about, but with something we should be concerned about.
Just real quick, Doc, this is a new situation. That particular disease is new, that's attached to this, just like the virus is new, or this is a familiar disease that is rare?
So this is really what we call Kawasaki disease, or Kawasaki syndrome. It's seen in other kids who get viruses, but we become aware of it because we're so tuned into this particular virus called COVID. But it is a syndrome that can be controlled and children don't necessarily die from it, but it can make the child very sick. But parents should be aware that this is a very rare event.
Well, Pennsylvania's governor this past week recommended that youth sports leagues delay their fall seasons until 2021. A lot of passionate reaction in this one. In your view, how safe is it for kids to play organized sports right now?
The short answer, Lucy, is I think it is safe for kids to play sports. And by the way, I get asked this question by a lot of folks, including my grandkids and their parents who live in Haddonfield and Livingston, New Jersey, respectively. Those kids are very active in multiple sports, and there's been a lot of concern. So there has to be some thought given to the sport. The risk of COVID-19 spread can be different depending on the type of activity. You have to bring supplies for the kids so that they can be safe. They have to wear masks whenever it's possible. There should be hand sanitizer. If the child is at increased risk for severe illness or has any significant pre-existing conditions, they shouldn't be doing youth sports. Physical closeness of the players is important, and the length of time that those kids are close to each other or to staff is important. Right. The amount of touching of shared equipment is important. So if you take into consideration all of the things that you can do to mitigate the risk, to lower the risk, I think it's safe for the kids to play sports.
All right, it's good to hear. They're getting a little tired of Zoom soccer these days. All right, as the race to come up with a vaccine continues to progress, we are learning a little bit more about how much it's going to cost. What do we know about that? And also, if the vaccine is available in limited quantities, who gets to be the first to get it? If they want it, right? That's a whole other conversation.
That is a conversation. Unfortunately, we have about 30% of the people in the country who don't want to take a vaccine, which to me makes not a lot of sense. But isn't it grand? Isn't it really grand that we're discussing not whether we will have a vaccine, but how much a vaccine it's going to cost and who's going to get it first? I'm glad that we're at that point in the conversation. As we've said before, there are 4 companies that are leading the way with vaccines. The British vaccine, which is AstraZeneca's vaccine, the Pfizer-BioNTech trial and vaccine, and Moderna are the ones that are leading the way. And then coming up in the rear, but closing the distance, is J&J, Johnson & Johnson, and Novavax. So in terms of cost, that's some very good news. Pfizer has announced that they will probably distribute a 2-dose regimen that will cost about $39 a patient per vaccine. So that's good news. Johnson & Johnson has said that they'll make available 100 million doses of its vaccine for about $10 per dose. Moderna has said that they will make their vaccine available for about $74 a dose. I think they all realize that there's a lot of attention placed on them right now. The efforts to produce a vaccine rapidly and safely have won the pharmaceutical industry some real breaks from some regular criticism over high prices. So the news is good. I think we will have a vaccine. I think there will be at least one vaccine that will be available in a few months before the end of this year. We're closing in on the 4th quarter now. Moderna is shipping thousands of doses for its testing in terms of the 3rd phase of the trial. So we are getting very close to having some solutions to this problem.